This lecture concerns the delivery and safety issues when it comes to biologics. I describe the most common deliver routes for biologics and also discuss some of the risks related to these. Finding the most suitable route of administration for biologics can be challenging. Most biologics cannot be delivered through the oral route due to their susceptibility to degradation in the gastrointestinal tract. This means that biologics often are delivered as injections, which can be intrusive, and also, especially, for intravenous injections they need the assistance of medical professionals. This can impact patients, and if biologics are ever to become cures for everyday illnesses, and not only for serious conditions, then they have to be delivered in a patient-friendly way. Another problem with biologics is that they might have a fast clearance, and this demands that the drug needs to be delivered frequently or in rather high doses. While oral administration is generally preferred due to its convenience and patient compliance, it remains a challenge for biologics due to their large size and complex structure, making them susceptible to degradation and denaturation in the harsh environment of the gastrointestinal (GI) tract. The main problems are denaturation due to the low pH in the stomach and enzymatic degradation by enzymes such as proteases, peptidases, and nucleases. Furthermore, the large size and relative hydrophilicity of proteins makes it difficult for them to pass over the epithelial barriers, and thus uptake from the oral route to blood circulation is low. Epithelial barriers, such as those in the gastrointestinal tract and the respiratory system, play a crucial role in controlling the entry of substances into the body. They consist of tightly packed epithelial cells that form a physical barrier, limiting the diffusion of large molecules like biologics. There is no passive transport through the cell membranes of biological drugs, and paracellular transport via the tight junctions is restricted but occurs. Thus, biological are primarily taken up through active transport and receptor-mediated transport. Some biologics can utilize active transport mechanisms, such as specific carriers or pumps present on the epithelial cell surface, to facilitate their uptake. Other biologics can have receptors on their surface that can interact with specific receptors present on the luminal side of the epithelial cells. These interactions trigger the internalization of the biologic receptor complex into the cell, and then the complex is transported across the cell to be released on the basal side of the epithelial barrier. Finally, biologics can be transported into the cell by pinocytosis. This is a process where the epithelial cells engulf fluid and solutes from the luminal side, including biologics dissolved in the fluid. To enhance the uptake of biologics across epithelial barriers, researchers are exploring various drug delivery technologies, such as nanoparticles or liposomes, which can improve the transport of biologics and protect them from degradation in the environment of the GI tract or respiratory system. The use of excipients that open up tight junctions or penetration enhancers are some other strategies investigated to increase oral uptake. Lymphatic uptake is another important pathway for the absorption and distribution of certain biologics in the body. The lymphatic system plays a crucial role in transporting various substances, including large molecules like biologics, from the interstitial spaces between cells back into the bloodstream. This process allows biologics to bypass the liver's first-pass metabolism and avoid degradation, leading to improved bioavailability and extended circulation in the body. This is especially important for oral vaccines. Key advantages for lymphatic uptake are bypassing first-pass metabolism. By avoiding the liver's initial metabolism, biologics can maintain their structural integrity and therapeutic activity, leading to increased bioavailability and efficacy. Prolonged circulation. Biologics taken up by the lymphatic system tend to circulate for longer periods, potentially extending their therapeutic effect. Reduced systemic exposure. lymphatic uptake can reduce systemic exposure to biologics, potentially minimizing side effects in non-target tissues. However, not all biologics have significant lymphatic uptake. The extent of lymphatic uptake depends on several factors, including the biologic size, charge, and specific interactions with lymphatic endothelial receptors or transporters. Due to the problems described, biologics are mainly delivered as injections. The most common routes for injections are intravascular routes. This includes intravenous, IV, delivery. This delivers the drug directly into the bloodstream via a vein. Intraarterial delivery is more challenging and less common than IV administration and is usually reserved for specialized treatments, such as targeted cancer therapies. There are also non-intravascular routes. These are intracutaneous or intradermal, delivery of biologics just beneath the skin surface. Subcutaneous or hypodermic, injection of biologics into the subcutaneous tissue, the layer between the skin and muscles. Intramuscular, injection of biologics into a muscle. Each route of administration offers specific advantages and is chosen based on factors such as the biologic's properties, the target condition, desired pharmacokinetics, patient comfort, and safety considerations. Intravascular routes like IV administration allow for rapid systemic distribution, while non-intravascular routes like subcutaneous or intramuscular injections can provide sustained release and avoid potential complications associated with direct vascular access. In subcutaneous administration, the drug is injected into the layer of tissue just beneath the skin. The drug is gradually absorbed into the bloodstream through the capillaries in the subcutaneous tissue. It is commonly done using a short needle, and thus this method is generally well tolerated and less painful than other injection routes. Subcutaneous administration is relatively easy and thus it allows for self-administration, making it convenient for patients and promoting compliance. Compared to intramuscular administration, there is a lower risk of accidentally injecting the drug into a blood vessel. The volume of injection should not exceed 1 milliliter. Injections carry various risks, including infection at the injection site, adverse reactions such as allergic reactions to the medication, reactions to endotoxins, or reactions such as clotting induced by foreign particles and the formation of antidrug antibodies, ADAs. Other risks are bleeding or bruising, damage to nerves or blood vessels, and the potential for accidental intravascular injection. Proper technique, sterile equipment, and careful administration can help mitigate these risks. For patients, it can be important to change the injection site when frequent injections are done. Unknown particles, when in medical formulations, can trigger several adverse effects. These particles can provoke inflammation and initiate an immune response. Moreover, if the particles are of a size that allows them to clog small blood vessels, they can impede blood flow. In some cases, these particles can become trapped in the blood vessels of the lungs, leading to pulmonary embolism. To ensure the safety and quality of medical products, it is important to conduct tests to detect both visible and subvisible particles. Visual inspection is performed on all containers to identify any visible particles that may be present. Additionally, representative containers are subjected to subvisible particle testing. Using methods such as light obscuration, this method involves passing the formulation through a sensor that uses light scattering to detect and count particles. It can provide information on the size and concentration of subvisible particles. Microscopic examination, microscopes equipped with specialized techniques, such as darkfield or phase contrast microscopy, can be used to visualize and analyze subvisible particles in the formulation. Flow imaging. Flow imaging uses imaging technology to capture images of particles as they pass through a flow cell. It provides detailed information on particle size, shape, and morphology. When foreign particles come into contact with blood, they can trigger a cascade of events that lead to blood clot formation. The presence of foreign materials can activate platelets and the coagulation system, causing the formation of a blood clot around the particle. This process is known as thrombosis. Foreign particle-induced blood clotting can have various implications depending on the location and size of the clot. In some cases, it can lead to blockage of blood vessels, impairing blood flow and potentially causing tissue ischemia or infarction. Blood clots can also travel through the bloodstream, leading to embolism in distant organs. The host's unwanted immune response to a therapeutic protein can result in the formation of antidrug antibodies, ADAs. There are two types of ADAs: non-neutralizing ADAs and neutralizing ADAs. Non-neutralizing ADAs do not directly affect the therapeutic protein's activity but can still impact its pharmacokinetics, leading to faster clearance from the body. Neutralizing ADAs can specifically bind to the therapeutic protein and neutralize its activity, resulting in a loss of therapeutic efficacy. The presence of ADAs can trigger immunological reactions during infusion, leading to adverse effects, such as fever, pruritus, bronchospasms, or cardiovascular collapse. In some cases, the immune response generated by ADAs can also extend to endogenous proteins, potentially causing autoimmune-like reactions. The formation of ADAs can vary in intensity and frequency among individuals and can be influenced by factors such as the drug's immunogenicity, patient characteristics such as genetic factors, immune status, and treatment regimen, e.g., dosage, frequency of administration. But, also factors related to the drug products might be important, such as how human-like the antibody is. Post-translational modification, and impurities. It is known that protein aggregation can increase the risk for ADAs. Strategies to mitigate ADA formation and its impact on therapeutic efficacy include optimizing drug design, modifying drug formulations, using immunosuppressive agents, or developing tolerance-inducing regimens.